Dr. Alex, a tech-savvy physician with a passion for innovative healthcare, and Nurse Jenny, a skilled and compassionate nurse, are about to embark on an extraordinary day of providing care for Mr. Thompson, a senior man recovering from surgery. Today, they will also be training a new intern doctor, Sarah, on the latest cutting-edge technology in healthcare, the XR-powered hospital at home. It all begins in the immersive virtual environment where Dr. Alex and Nurse Jenny don their VR headsets. Using advanced 3D scanning and photogrammetry, they enter a fully replicated digital twin of Mr. Thompson's home. From their remote location, they can virtually walk through his living space. Nurse Jenny points out the risk areas for falls in the kitchen and living room. Together, they review Mr. Thompson's mobility needs, suggesting the relocation of a few items and adding safety equipment near his bed and bathroom. Through mixed reality, Dr. Alex projects a 3D model of Mr. Thompson's knee, recently operated on, to explain the healing process to Sarah, the intern. Sarah watches as Dr. Alex overlays the 3D image into the virtual home, showing how the knee's movement will be monitored in real time during rehabilitation exercises. Nurse Jenny walks Sarah through the mobility and accessibility optimization they've recommended to reduce the strain on Mr. Thompson's knee as he recovers. Real-time monitoring and XR-enabled interventions. Meanwhile, in the background, Mr. Thompson wears a set of non-invasive remote patient monitoring (RPM) devices. These IOMT sensors track his vital signs, heart rate, oxygen saturation, and glucose levels, continuously transmitting the data back to Dr. Alex and Nurse Jenny in real time. Dr. Alex pulls up the data, displayed on an augmented reality interface, and immediately notices a spike in Mr. Thompson's blood pressure. With the XR-powered system, he quickly adjusts the care plan and communicates directly with Mr. Thompson via a virtual consultation. The senior patient, sitting comfortably in his home, is reassured by the personal care being provided without the need for a hospital visit. Sarah, fascinated by this seamless integration of real-time data, watches as Nurse Jenny conducts a virtual nursing session. Using AR, Nurse Jenny remotely guides Mr. Thompson's daughter, who is his caregiver, through the proper administration of medications and explains how to monitor his vitals. This XR-powered interaction ensures continuous care while empowering Mr. Thompson's family to take an active role in his recovery. Simulated training and emergency response. As part of the intern's training, Dr. Alex initiates a simulated emergency response using XR. They virtually simulate a scenario where Mr. Thompson's blood pressure drops suddenly, requiring immediate intervention. Dr. Alex and Sarah practice the steps to stabilize Mr. Thompson, reviewing the use of complex medical devices in the simulation without any risk to the actual patient. The hands-on, immersive nature of the XR training provides Sarah with the confidence and skills needed for real-life scenarios. Additionally, Nurse Jenny walks Sarah through the use of Mr. Thompson's ventilator, showing how XR technology provides an interactive, step-by-step tutorial on managing the device in real time. In this virtual training environment, Sarah can repeat the procedures as many times as necessary until she's proficient. A new era of care. By the end of the day, Dr. Alex, Nurse Jenny, and Sarah have provided comprehensive, patient-centered care to Mr. Thompson, all through the XR-powered hospital-at-home model. Mr. Thompson remains comfortable in his home while receiving high-quality, personalized care tailored to his needs. Sarah, the new intern, has learned hands-on techniques and gained confidence in the use of advanced medical technologies, all in a safe, immersive training environment. For Dr. Alex and Nurse Jenny, this day represents a glimpse into the future of healthcare, one where the boundaries of traditional hospital care are broken down, replaced by an accessible, efficient, and immersive approach that keeps patients engaged and cared for in the comfort of their homes. This XR-powered care model not only enhances the quality of care for patients like Mr. Thompson but also transforms how future healthcare providers like Sarah are trained and prepared for real-world medical challenges.